Hey guys, Dr. Carpenter here with Lexington Spinal Care. I'd like to talk to you today literally about one of the most common reasons why we see low back pain. So when a patient comes in, part of their description, sometimes they'll tell us like they feel like their pelvis is off, or they feel like one leg is like shorter than the other. We also hear where they might feel like their pants leg is shorter on one side and longer on the other, that sort of thing, a real common thing on that. But actually, when we actually take an x-ray and we actually look and we actually can measure, we can really see if one pelvis or one hip is higher than the other. And so here's a perfect example of that. The x-ray that we took of this lady, she was having a lot of back pain. Check said it had some numbness and tingling going down into the leg. When we took the x-rays, one of the things we see is that her left hip is high. And then we can obviously see how much lower her right hip is. And when you look at the spine, you can see the spine is getting pulled outside of its midline. When that happens, it creates a lot of instability in the low back. You can have low back pain, you can have SI joint pain, you can have hip pain, it can eventually lead to knee pain and foot problems because the very foundation of what you're standing on is no longer level. So your body has to adapt around that. So one of the things that we do when we take an x-ray when somebody's having a low back issue, the first thing we want to establish is their pelvis level, because that's where it's meant to be in terms of that. There's lots we can do for this person. There's lots we can do to help this person, help them reestablish a balance in their pelvis so they don't have what's called pelvic sacral unleveling. And it really is a game changer because that stops the instability in the future. So 5 years from now, we're not really worried about the same kind of back problem over and over again. But when somebody's pelvis is out of balance in this way, it's not really a pill or a potion or a shot. We've all been there, we've taken it stuff. That's why it just keeps coming back, because the problem's really a structural or a foundation principle behind that. And those are things that we certainly address here in the office. So if you're interested in scheduling an appointment with us, take advantage of our new patient special. Just click the button and it'll lead you right into our website where you can schedule an appointment on site. You don't even have to call anybody. You can do everything online with us. And we look forward to seeing you.